Thank you, Governor Baker. It is an honor to welcome you, your team, and all of our guests today here in Norwood. We are very proud to be a Massachusetts company since our founding in 2011. We opened our Norwood facility in 2018. The facility has been an integral part of our strategy to fight the COVID pandemic. I would like to thank Tony and the town of Norwood for being great partners from the very beginning. Massachusetts continues to be a global leader in the biotech industry. Having our manufacturing facility here in Massachusetts has always been incredibly important for you. It's enabled close collaboration between our research and development team in Cambridge to this manufacturing and technical development team here in Norwood. It allowed us to work with our partners in the state to leverage the incredible innovation of the state, and we'd like to thank you for your support over the years. We are proud to have created a new biotech and manufacturing jobs here in Norwood to make the mRNA vaccine. Last year, in the last 12 months, we created around 650 jobs in Norwood. And we continue to grow the company. We have around double the company size in the last 12 months. And we're not done yet. You can look at the job posting. We are hiring. I want to thank the Moderna team, particularly those that are based here in Norwood, who have been working around the clock, 7 days a week, to manufacture the Moderna COVID-19 vaccine. The team is working hard to ensure high-quality products and to ensure we make as many doses as we can. We know that every dose can save another life. Our employees' commitment to our mission has been exemplary. People have sacrificed vacations, weekends, birthdays, evenings with families, and much more. We all owe them a lot. Because of this commitment and this performance, we announced last week an investment and expansion of our facility in Norwood. We are more than doubling the space of this facility to make it a truly industrial technology center with 3 buildings. This expansion will support 50% increase in production of our COVID-19 vaccine in the United States, with a ramp in the end of the year and early 22. Last week, we raised our goal to make at least 800 million doses in 2021, and the team is still working really hard to get to 1 billion doses. We're investing right now in Massachusetts so that we can get to up to 3 billion doses in 2022. We're also working hard to remain ahead of the virus. We're exploring a strategy to address variants of concern with an updated variant booster vaccine single dose. We shared last week some positive initial clinical data showing that 2 of our booster strategies are very encouraging. We are waiting for the 3rd one in the weeks to come, and then we'll work with the FDA to get a safe and effective variant-specific booster to the American people as fast as we can. As we grow, it is very important for us to build this plant with respecting the environment. This is very important to the company. We want to be here for a long time, and we need to respect the environment. Thank you again, Governor Baker, and all of your team and guests for being here today and supporting Moderna's mission. It is heartwarming to see Massachusetts as the 2nd most vaccinated state in the country. Congratulations for all your hard work and to all the healthcare workers in the state. I would like also to thank you for your leadership and the leadership of your team over the last 14 months. We know how hard those have been, but thanks to you, we have navigated as a state the pandemic, and you've kept us safe. It gives us a lot of joy to see that yesterday there was no death in the state of Massachusetts. Thank you so much, everybody. I hand back to you, Joanne.
You guys have questions for Stephane? Start there.
Yeah, do you mind talking about the booster, how that would work? And then obviously we have 3 companies. Is there a plan to get people the booster, and do they have the same company?
Yes, so we indeed are testing the booster in the clinic after the Moderna Prime series that were injected last year in the phase 3 participants. But our goal is working with the NIH and others to test the mixing of the vaccines, meaning regardless of what vaccine you got initially in early 2021, that when it's time for you to get a booster, you can mix the products.
Do you have the amount of time you need it?
So we're still looking at the clinical data because, unfortunately, it's a new virus and the vaccines are still new, so we are studying this very carefully with the regulators. But we think it's not impossible that maybe in the fall, for people that were vaccinated very early, last December, last January, especially for people at high risk, that it might be necessary, especially with the emergence of variants of concern. So we're working with state officials to make sure we are ready at the right time.
So, could you give us an update on the phase 3 studies on children for the Moderna vaccine. We know Pfizer is maybe a week or 2 ahead, but how are you coming?
Yes, so we shared last Wednesday news that the Moderna vaccine in the 12 to 17 years of age has a 96% efficacy. The safety profile is like what we saw for the adults. And we're working with the FDA to get the vaccine authorized as soon as we can. We're also running a study in the 6 months to 11 years of age. That study is going to take a few more months because we have to go very slow down in age to ensure the safety of the children. And we're also starting at a lower dose because given their lower weight, we might need a lower dose for the children. But for the teens, it's going to be the exact same dose, which will help the distribution of the vaccine than the one used in the adults right now.
Do you think it's important to vaccinate children? How important is it to stop the pandemic?
So if you think about herd immunity that many of you have heard of in the last months and quarters, we think it's important, as we know, the children, because of a strong immune system, a lot of time don't get disease, but they can transmit the virus. With the spread of variants of concern, I think it's important to really vaccinate as many people as we can, but I leave it to the state officials to dictate the right policy for the state.
Could you just clarify the booster issue? How many boosters are you working on, and when might they be ready for use?
So we're looking at 3 booster strategy. The current vaccine given as a boost. We're also looking at a vaccine that we developed that is specific against the variant first identified in South Africa. It's 100% of a copy of a spike protein information that we dropped in exactly the same product as a vaccine that many of you have received. And we have data on those 2. What we show is against the variant of concern, both vaccine looks good, but the vaccine designed with a specific South Africa strain looks stronger. And we anticipate it could be a longer duration in terms of efficacy. The third vaccine strategy, which is a mix of 50-50 mass ratio in the same dose of existing vaccine, and the one designed against the strain of South Africa, we should get the data in the next few weeks. When we have that data in the clinic, we will pick which one we'll take for authorization. We'll run a bigger study. The FDA, as I said, very clear, very helpful guidelines, and we're hoping that toward the end of the summer or early fall, we should be able, if the data is good, to have an authorization for a boost to be used in the fall to protect all of us so that we can have a good fall and the next good winter.
Can you just clarify something with the 12 to 17-year-olds? We're hearing a lot about Pfizer today, 12 to 15-year-olds. When do you anticipate to move with the FDA on your vaccine for that age?
So we're talking weeks. We're not talking months away. We're talking weeks away. As we know, the safety of those products is critically important. And so we are working with the regulators. The FDA has been amazing over the last 18 months with sometimes daily discussions and exchange. So safety is priority number 1. And when the FDA will feel comfortable, we'll get the vaccine authorized.
How about in terms of the facility here? Well, how much expansion will you be doing? You said 3 buildings. Do you have, how many buildings do you have now? How much square footage are you going to be adding, et cetera?
So we initially had around 250,000 square feet in this building. And with the new buildings, we're going to get 650,000 square feet, so it's almost tripling the capacity. And in terms of the output, our plan is to increase by 50% the output coming out of the Norwood facility to supply the world.
When do you expect to have the facility expanded here?
So we already started. So the governor and the team visited a new wing of the building this morning, but it's going to happen during this year. Our goal is during this year to have more and more capacity coming online, hopefully by the end of the year to be able to be at full capacity.